And there we are. Wilson, let's do this. You got coffee in your system?
Well, I'm actually trying the new Blackberry Dr. Pepper this evening for the first time. So I'm going to
Wow.
give it, I mean, it's honestly not that bad. It's a good, refreshing flavor. It's not endorsing, but I would say if you're into alternative sodas,
Yeah.
just like
I
alternative
think
healthcare,
I
Blackberry.
I yeah, I think that's good. I'm glad we're going to start off our first podcast with a plug for a soda company.
Yeah,
Nothing says the state of American healthcare like carbonated, caffeinated, sugar infused
it's banned.
sodas.
Yes, that's right.
All right. Welcome and hello to everybody watching or listening to the number one DPC related podcast in the world. We're number one, Joe. And I don't know if you knew that, but we are the number one podcast directly, specifically targeting DPCs in the world.
Congratulations.
Yeah. Well, thank you. Thank you. It's been a battle to get to this point, but here we are.
Yeah.
Uh, so today, as my guest, is Joe Wilson. Joe Wilson is a lifelong friend of mine. At least it seems like lifelong. We've known each other like 5 years.
Yeah. Sorry, you have to mind the train in the background right now. Can you hear it?
Is that a train? Is that a metaphor for American healthcare right now? Is it about to run off the rails?
No, it's leaving the station. That's what's happening.
So that must be DPC we're talking about.
Yeah, that's right. All aboard.
Well, nothing like a train to interrupt the kickoff of a podcast. So, Joe Wilson, you are with Frontier Direct Care. We've known each other for years. We're not going to, put a veil over the fact that we've known each other. We've worked alongside each other in DPC. And when I sat down and decided to start the best DPC podcast, I said, first person I want to have on the podcast is one of my best friends, Joe Wilson, a pioneer, a warrior, a fighter. He was always there advancing DPC. And I said, we got to have Joe as the first guest. So, Joe, welcome to the podcast.
Yeah, thanks for having me.
Yeah. So Joe, tell me about your day. Now, this is 9:35 p.m. that we're recording this podcast. Like, what happened? We were supposed to do this at like 7:00 this morning.
Well, that's a good question. It's a long story that I'll make short, but it involves a washing machine, the town of Corpus Christi, Texas, and probably forgetting that I had somebody flying in for an in-person meeting today. That was 2 hours long, and then realizing at about 9 o'clock this morning, oh, I can't work remote. I need to be back in Harlingen. So that's how it started. And then I just got done delivering that washing machine over to Alamo, Texas. And so here I am now, diving back through the office for a podcast with you.
Wow. You know what? I feel honored. So let me get this straight. So you were going to work remotely, and instead you became was that dishwasher? You said
It was a washing
dishwasher.
machine, laundry.
Oh, washing machine, laundry machine. So you installed that today instead.
No, I just had to drop it off. That's it.
You just had to drop it off. Okay. Well,
Free.
I'm glad. I'm glad you made time for this pod. So Joe, we're going to talk a little bit about American healthcare, and just to dive right in, from your position and the state of things, what are you seeing that is wrong with American healthcare? I mean, frankly, why is it so terrible, Joe?
That's a loaded question for sure. I think
I wanted to start easy with you, Joe.
yeah, some low hanging fruit. It is a big loaded question. I think, the thing I see from even an administrative side, watching that transition over the last couple of weeks, and even as we think through like what we see on the commercial side with private businesses, is a lot of times where people are attacking the coverage aspect, right? So they're angry or they're upset at Blue Cross or United or these big carriers, or they're angry at the hospital. And really, I mean, unfortunately, you have to tell everybody, like, it's your choices, right? And so it's an education and an understanding of actually how you go procure care. And a lot of people are still over here fighting the coverage side of things and not actually addressing the care side of things. I think the administration's moving in a better direction towards some of the care delivery pieces, but still a long way to go when the oversized bear in the room seems to be insurance carriers, and that seems to be what gets addressed first. So that's probably the biggest thing I see is wrong with it. Is I think we're in some ways attacking the wrong thing first, and it really has to be that patient education, consumerism, to make sure that they understand how to engage healthcare and what to use it for and how to use it, and that would change a lot of what's going on.
So, for those that are listening that may not quite understand the difference between coverage and care, I mean, most people, at least in the traditional sense, they take their insurance card, they go to the doctor, they use that insurance card with that doctor, they get the prescriptions with that card, they get the labs with that card. That magic card takes care of all their problems. So, when we talk about the difference between coverage and care, how would you describe those differences and kind of lay it out in layman's terms?
Yeah, I mean, I think, ultimately when we look at a large insurance carrier or we think about an insurance network as kind of maybe a familiar term, you get in network or out of network coverages. And if it's in network, that means that there's probably been a contract between, let's say, an insurance carrier like United Healthcare and that provider, their own personal business that might be, Wayne Lowry's medical clinic, right? And so United
I
Healthcare.
would not I would not go there.
Yeah. So United Healthcare comes in, does a contract with you. And then ultimately there's some, rates that are associated with your services that you can send your claims to United Healthcare when members come in with that insurance card, and they will reimburse you with money from those employers that those people work for from those health funds, right? Whether those are premiums that United has kept and are doling out, or if it's simply money from their medical claims accounts. So when that coverage, that's just simply saying that there's a vehicle or a method or a platform that is available for you to pay for your medical services. That's what insurance is doing. They're giving you the platform to process payments on in what seems like and may have been for a long time a more efficient manner, right? Than maybe just going out there and trying to figure it out on your own. And then more so though, when you look over at care, it's actually those people that own those businesses that pay that lease and have those machines and employ that staff that put hands on you and actually administer a procedure or care or give you a shot or prescribe a medicine. That's the difference. And you can actually go buy that care and not have to actually go and do the network, right? The network kind of gives you an overarching, easy to use method, but it's not always the most affordable method. And so it's good to have it, to have insurance. It's also great to go and procure care and make sure you're getting the highest value for your dollar.
So when you're talking about the highest value of care, obviously, we're familiar with the direct primary care model. What would you say is some of the real benefits to direct primary care over the traditional healthcare model?
I think the real benefits of direct primary care is it's extremely versatile, and so whether you're in a fully insured, typical insurance program that a lot of small businesses have, where they just simply pay premiums to their insurance carrier and then that money is gone, whether you use it or not. Whether you're in that program or you're in a self-funded, fully customized insurance program that your employer has put together. Either way, DPC has a very powerful role in both. When we look at fully insured, one of the coolest things I like to think about is, obviously, let's just make up some fake numbers here, but like somebody's paying a $500 deductible or a $500 premium, right, for their insurance package. Maybe they've got a $5,000 deductible, some maybe it's a higher out of pocket, like an $8,000 out of pocket. It's a pretty inexpensive plan given the current market where it's at now. But in order for them to go up and have maybe what would be like $0 copays and $1,000 deductible and really low drug copays as well, that top plan on that renewal that you're going to get is probably going to be like $1,200 per person per month, right? And the cheapest plan might be $400 per person per month. And the big difference between that being your out-of-pocket exposure and the copays or the amount of money that would be charged for you to get care for the first time, right? And so a lot of times those more expensive plans, it's cheaper. The copays are $10 or free for primary care, but they're going to cost you $1,200 a month. You can go and get that lower fully insured plan that might be maybe $400 or $500 a month. Add direct primary care, and I know out there's several DPCs ranging from $60 a month to $120 a month seems to be kind of around the threshold. And so you could stack that in there, and now for roughly $550 or $600, you've got a plan that with DPC and a low premium insurance plan is driving a similar value to the top plan on the list that would have effectively cost you like $1,200. So you can really take something where you want to give your employees better benefits. You can do that by still giving them an affordable, inexpensive insurance plan, but then tacking on DPC, and now that thing is working like the Rolls Royce of insurance plans. The same thing you see when you move into the self-funded space is the best thing I see there is that, and when you're familiar with this, right? You stand up front and you tell, I don't know, a couple hundred employees like, hey, here's what we're doing today. And 2 minutes later, probably, almost
they all forgotten
all of it. And they don't have any clue what we were supposed to be doing today. And they're coming back to you and saying, hey, boss, can you tell us again what the plan was?
No, they were coming back complaining about the snacks you offered in the presentation. That's what they were doing.
Probably so. And so that's what happens out there is a lot of times we have really creative advisors in the insurance space. You have really specialized and intentional people in the human resources space or benefit administration space. You've got very innovative vendors in the market that have everything from virtual care to mail order drugs to international sourcing to 340B to 501R, all these programs that can really help alleviate the risk from your plan and save you a ton of money and get your people better care faster. That's all available, and you can spend all year building a very cool plan for that. But the problem is when you just let that plan go out to the open network and you're telling that to your employees and then they walk out and walk into the nearest hospital, nobody at that hospital knows what your plan is. The only thing they're going to recognize for the most part is you got it from Blue Cross or United or Aetna or Cigna or whoever that might be, and that's where they're going to send their claims. When you have direct primary care, those plans can be communicated with your providers. And so that first experience that your employee has, now all those cost containment features and great plan design things you did to really enhance the benefits can be communicated not just at open enrollment, but at every single patient encounter. And so we're eliminating a massive amount of medical waste in that and just making sure that people are able to get in, see their provider, understand the options that are available to them for downstream referral use, whether that's a direct contract or a pharmacy program or a wellness program or even an occupational health program. They're able to be coached through that with their dedicated primary care provider. And that solves a ton of the cost issues just by not allowing or not setting up an ecosystem where everything you're doing is falling on deaf ears every day.
So, Joe, you're talking about a comprehensive approach to solving the problem of coverage and care. What about these small DPCs and small clinics that, I mean, we've seen, there's thousands of them across the United States, and every day since I've launched this directory, bestdpc.com, we have almost every day we've got a new clinic. And it's fascinating when I'm looking at their story and seeing, several of them may have 200-300 members. They may be one provider or two providers, in a single clinic, how can they engage in this overall process when there's such a small site? Like, what can they do to help employer groups, whether they're small, medium, or large, to provide DPC to those employees, and how will it benefit those small employers in those situations?
Yeah, I mean, I think it's even and I know you were a part of Frontier's journey for a lot of seasons there, and so you watched it happen too. We started out like every other mom and pop DPC out there. We had a little bit bigger vision. We knew we wanted to scale and we wanted to be able to grow to be multiple locations because Dr. Pete, our founder, wanted to be able to invite the residents that he was teaching. He wanted to be able to invite them into a direct primary care model, and he just simply saw that the risk for those residents to come out, hang up a shingle, and go out there and start doing business. The delta was just too wide for any of them to really jump across it. And so he knew he had to kind of do it himself and then create the bridge to bring other providers and physicians into this model. And so, I think the biggest thing we did first was we created that vision, right? And so you got to know where you want to go. And, one thing I recommend for that is the book Traction. I think we made you read it, Wayne, when you joined the team
Yeah.
for a season there. And it was like, this
I
is what
I
we're
have Well, and not only that, Joe, I'll tell you, I've taken that with me in every other little startup or venture since leaving Frontier because it is such a great tool.
Yeah. And it's simple, right? And so, but at least having that, because I think the second part is, one, you got to have a game plan. And then two, with that game plan, it should tell you exactly what kind of team you need to build. And so, thinking through, there's Traction, Gino Wickman, the author there. Buy it on paperback. You can do the audio book. You will need some of the resources in it. So I don't recommend the audiobook by itself, but there's a ton of online resources as well. But that was foundational to us starting our business. And as we built a team, I think that's the second part is you gotta have a game plan. You got to have a team to execute that game plan. Sometimes it's a combination of, you wear a lot of hats when you start that first DPC. And so you're the
Yeah.
head of marketing, the head of HR, all those things. And as you're hiring and growing and scaling and doing sales and trying to work with brokers and learn insurance, like it is a lot to undertake.
I want to take a quick break to talk about bestdpc.com. Are you a doctor looking to break free from the headaches of insurance and take control of your practice? Or maybe you're an employer searching for an affordable healthcare solution that actually works. At bestdpc.com, we cut through the noise and connect you with the country's best direct primary care clinics. Whether you're a patient tired of surprise medical bills or a physician ready to build a thriving membership-based practice, we've got the tools and resources you need. Find the best DPC doctors near you, get expert advice, and take the first step towards a better healthcare. Visit bestdpc.com today and see why direct primary care is the future of medicine. That's bestdpc.com because great healthcare should be simple, affordable, and built around you.
The first things I think about when people are going to start working with employer groups as a direct primary care is they need to understand what they're getting into. And one is it's got a lot of upside in that you get to have one, decision maker in a lot of ways. And we'll make this seem very simple, but it's not. But maybe you talk to one person and you have one or two meetings and you gain 50 new lives for your practice, right? And that sounds pretty awesome. And trust me, when you look at your membership thing and it bumps up 50 new people just register for your DPC and you've been floating along for, 8 months with like 100 members, you're like, oh my gosh, we have found the magic sauce. Like, here we go. But with that comes a lot of things. There's a massive process to open enrollment, to communicating what the benefits are, to having those materials, marketing, and all those things ready to educate those new members about that DPC, really having a great consultant or broker or advisor, whoever you're kind of working with there, making sure they understand how to operate a plan that has DPC in it, because it's not the same. I mean, it can feel very similar, but there's a lot of ways that you can make it challenging, and there's a lot of ways that you can make it very efficient. And so, understanding that, thinking through that, giving yourself enough time too. That's a big one. I think early on we got into the rat race of like, hey, they want to sign up. Okay, we'll see you on Monday, right? And not actually going over and educating the patient. And so on the backside, we would have employees who, the business owner didn't know how to talk about DPC, the broker didn't know how to talk about DPC, and they're the ones that did the open enrollment. And now you've got 15 people walking in your door saying, I'm here to see the doctor. And you're going, we do that by appointment. And now they're all frustrated because nobody told them it was by appointment only. Right. And so you got to just make sure you're really methodically walking through that checklist. And then I think the second part, or another addition to that, is don't get out over your skis. And that can be a big challenge that, you're maybe a one or two provider practice, and you're trying to keep your patient panel at 600 people or so. And all of a sudden you get an opportunity, maybe a great broker comes through and says, look, I got a 300 person group. Do you want them? And you say yes, and you take them on, and you realize half your business is now contingent on one person making a decision if they want to keep using you. And in addition, if that one person is a city leader or a church leader, there's a lot of reality that they might not be there in 2 or 3 years, because those are kind of some transient jobs that we often see. And so they made a great decision, but are they going to back it up 2 or 3 years now when it comes time for renewal? Or is it something that's just going to be cut out?
It's hard when you're, at any capacity, you might say, to put all your eggs in one basket. So either, as you scale, as you're examining your capacity and whether or not you want to take on, business clients into your practice, one of the things, like you mentioned, you got to know your capacity and know if you're really willing to put that many eggs in that basket, because who knows what could happen. You lose that one client, then all of a sudden you're back at square one. And as you could probably state better than I can, there is a chance you will lose some existing customers because you have to shift your focus, and all of a sudden those one-on-one interactions that you were so freely giving to your patients become harder to do, and now your new partner in the business, or a mid-level that's taken part of your load, or whatever your case is all of a sudden the face that this one patient is now seeing instead of your face. And so there's a lot of challenges and opportunities in some of that. So I guess if you were to just kind of sum up or wrap up this section of thought, what would be the number one caution you would give to any DPC? What would be that one little piece of advice going through what you've gone through, to any small DPCs that are looking to expand on that?
Yeah, I think ultimately, finding a mentor in the space is key. And so, whether that's talking to a DPC down the road that's maybe a season or two ahead of you, and just asking like, hey, how does your patient agreement look? What kind of contract did you have to put together? What were some pitfalls or some heartaches that you went through? How do you even judge or think through a sales cycle, right? Like, and when do these sales even happen, right? That's a big part of it. And I think just finding that mentor that can look around the corner for you, you can ask questions of, is great. We've done it a lot when we were growing up. I remember, and big shout out to our friends at First Primary Care, like just up the road in Houston. They were a couple seasons ahead of us, and they had a great website, and they had a great like sales funnel, and they had members coming in. They were getting 2, 3, 4, 20 a day at sometimes, right? Just retail members finding them on Facebook, signing up, and I thought, that's incredible. And talking to Jay Medley up there, he just said, hey, man, we want the whole movement to grow. And so he opened up the playbook and said, here's the vendors we use for our tech stack. Here's the things we put together. Here's how we drive some membership. And so there's a lot of people in the DPC community that are very willing to share how they got to where they are, or things they wish they wouldn't have done. And it helps us not pay the dumb tax, is what we call it. So don't pay the dumb tax, find a mentor. That'll take you a long way.
Well, I appreciate the discussion on kind of the overarching movements, the problems, the solutions, and DPC. But I want to take a little bit of time now to talk a little bit about Frontier Direct Care directly, and specifically just looking at your involvement there, what you've seen, and talk a little bit about that experience. A couple things that come to mind, Joe. You know, some kids when they grow up, they want to be firefighters. Some kids they want to work for NASA. You said I want to change healthcare, right? You were that 5-year-old boy that said I want to change healthcare for America.
Yeah.
So
Me driving a NASCAR, maybe. Like I was all into like let's be the next Dale Earnhardt here, like checkers or wreckers.
so what you're saying is you didn't exactly think you were going to get in healthcare. So Joe, what drew you to direct primary care? Why did Joe Wilson give up the NASCAR and go to traditional into direct primary care?
Well, first we're going to look at this thing called a budget, and I don't have a couple $1,000,000, so we don't have a race car team. But then we'll
Okay.
get to the next part.
Yeah.
What drew me to it, honestly, was I'd done 20 years of nonprofit outreach ministry with high school kids and things like that, and Dr. Pete was my committee chair for the organization I worked for, Young Life, and Bibb, our CEO, was my finance chair, and so they would help me raise money and spend money, basically. And so it really was just this kind of unique time as we went through the pandemic, and that kind of gave us all a chance to kind of look at this idea and do we want to kick something off like this and see if Dr. Pete wants to grow to have 2 or 3 clinics and invite other providers in. So that was an interesting conversation at an interesting time when we were kind of shut down with ministry stuff in the high schools. And I just knew that I had an opportunity. One, I had been volunteering with Culture of Life. I think you're familiar with them.
Oh
So
yeah.
for those who don't know, Wayne, I live in the same town. We live in the same neighborhood.
He's actually sitting right here next to me. No, I'm just kidding. That part.
I'm like 10 minutes away. But anyway, Culture of Life is a really cool ministry that Dr. Robinson has. And so I was able to sit on kind of the board of directors there for a season and help with some of the marketing stuff and saw this drastic need for those that have been marginalized to have access to healthcare. And when COVID hit, we realized the whole fee for service world out there had nothing on virtual. Like they couldn't bill or code for it. They didn't know how to access it. It wasn't a part of their electronic health records. So everybody trying to get diabetic medicine and things like that couldn't get in. So we stood up a virtual platform, went to the news media and did that. And I saw the impact it had just like that. And so really to watch people come in and thank you for just treating them as a human and looking them in the eyes and being able to care with them with compassion and give them the things that they needed was very basic but very life-giving. And so when Dr. Pete was like, hey, would you help me with this mission of restoring healthcare and bringing it back to what it should have been in direct primary care? And he was totally selling me on like the old school doc with a bag walking house to house at that time, because that's kind of what he was doing. I thought, well, that's fascinating. And so began to help out. Had a little bit of a knack for raising money, and so kind of used that skill set with Bibb and Dr. Pete to begin talking to investors to gather up enough capital to open up 2 or 3 locations and invite a couple of doctors in and try and sell in actually individual members at that point through Facebook or whatever into those locations. So that's how we got started, and then I don't know how much further you want me to go.
Well, so I'm thinking some of the kind of the interesting stories. We talked about how many hats you kind of mentioned in passing, how many hats someone might wear when they're starting a DPC. So Joe, here's a little trivia. Can you tell me how many hats you've wore?
Oh gosh. Officially, I've worn 3 now. So I started out as the chief operating officer,
Mm-hmm.
and you're counting this now.
I count.
And then after a while, like we knew that we wanted to bring somebody else for that role, and so I moved over to the chief growth officer, which was a little bit more ambiguous.
Yep.
And so I could do more things like product development, sales, all that kind of stuff. And
And
now,
that's when we shot rubber bands at each other from
yeah.
across the hall. Yeah.
And then now that we've kind of stepped into a really pretty well developed product, and we've got a whole lot of team members in specific roles, I've kind of moved over as like an executive vice president. And so mainly focus on the public sector and sales in with government services and things like that. And so we look at, new cities and locations and school districts and try to see if we can go and serve communities that are looking to solve access issues, and then partner with those communities and their brokers and advisors to build direct primary care centric plans, and either
So
employ another direct primary care out there and help connect them if it's not in our market, or if it's something we can serve, build a clinic and staff it and start doing DPC in a new community.
now I counted 3 official titles, but I also remember you being the guy that built the desks that we used
I
out of particle board.
I
Is
did
that not also one of your jobs, Joe?
It was. I was a furniture maker for a season for the new office furniture when we moved in here, and then
You ran the HVAC system.
my favorite was wearing the HR hat when I got to hire, primary care providers, and I knew hardly anything about actual medicine, right? Like I knew kind of how to build a team and was like trusting them, but was fascinating. I'm sure they were kind of like, this is the least medically inclined review I've ever had. But thankfully, Dr. Pete was there to ask the medical questions. I was there to ask the fun questions like, if you had to improve Domino's pizza delivery, how would you do it? And then they would answer, and I'd be like, that's a great answer. And then we'd move on. So,
You wouldn't. You would tell them it was a terrible answer. Stay in your lane, doc. That's what you'd say. Take a quick break to talk about scalebyseo.com. If you run a direct primary care clinic, you already know the power of patient relationships. But here's the thing. Patients can't sign up if they can't find you. That's where Scale by SEO comes in. We help DPC clinics get seen where people are searching, so you're not just waiting for word-of-mouth referrals. With the right SEO strategy, your practice becomes the obvious choice when people are looking for better healthcare options. If you're not showing up where they're searching, you're missing out. Be visible, get found, grow your practice. Don't leave growth to chance. Visit scalebyseo.com today, and let's get your clinic in front of the right people. All right, Joe. So tell us. So when I was working at Frontier, we had about 14 people on staff. We were in an old parts store. The AC didn't work. There were no doors. Except for there were some sliding doors for the HR department. I think that was about it. But the rest of us, we could hear every phone call. Tell me things have improved.
They've improved a lot. We're starting to. I think we've got well over 100 employees now. I'm going to mess up on the actual number. I feel like it's around 130, 140 folks are joining the team, rapidly expanding in some new markets. So that's really exciting. But yeah, it's gotten a lot better. Those days and where we were all, hey, I'm HR 1 minute, then I'm going to go do open enrollment the next minute, then I'm going to be sales, and then I'm going to do some marketing, and then I'm going to do graphic design, and then I'm going to work on some kind of tech process to help out Stephen with the, EHR stuff. Like it just, it was crazy, and it still is a lot of fun to dive into those projects. But now everybody's really got a good team behind them. What used to be hats became people, and then those people became departments, right? And so that's kind of cool to watch. It's just, even somebody, we hired one person that came in as a part-time graphic designer, and now they're standing in member services and really doing a great job, and moved over into concierge and referrals. And so to watch the development of those people and our team as they've grown up inside this company has been really special, and really freeing, just to see like your vision and dream that you shared with your friends and poured into so many people as you brought them into the team, like take shape, and now they're pushing that same mission forward.
That's awesome, Joe. So what is, I guess one of the last questions I had was, if you could, with one word, just say one word, and that one word would fix healthcare, what would that word be, Joe?
Trust.
Trust. Nice. Can you elaborate on that now?
We just asked for one word.
I know what I asked.
Trust to me is so much of the answer in everything we do in healthcare. Is one, I think healthcare. I love all the AI stuff. Trust me, it makes life a lot easier. But the reality is, I still need a relationship at the end of the day, and I still want to talk to somebody. I still need physical touch and somebody to help me when I'm hurting, and to administer healing. Like, that's a powerful thing. I think that we've been created for that person to and for that purpose, to engage one another. And so I think trust represents the relationship. I think trust also represents the transparency. And you and I have talked about this a lot in business, of looking at your partners and saying hey, this is the bottom line. Here's the budget. Here's where the money's going. Sure, we all got to make a living. Sure, there has to be margins in there. And if you're doing a great job, you get paid well for it. No problem with that kind of mentality. At the end of the day, if I can't ask a question and get a clear answer, or you're trying to confuse me with language I can't understand, it erodes that trust. And if you're stripping out relationships and confusing with language, we're eroding trust and transparency. I think the other thing is even as we talk about in the business side of it, where we've got consultants working with purchasers and vendors in that space. You and I have had to deal with this a lot, and there's a lot of people in these relationships, and you can't always trust all of them to do what's in the best interest of everybody, or the plan, or the member. But there are a lot of people with really great integrity in the industry, and so finding those that you can trust and assembling that team and working with those people, even though you might not be on the same team, you sit on the same side of the table in an attitude of trust. And so, yeah, trust is it.
Awesome, Joe. Joe, so before we completely wrap up today, I do want to ask you one thing. You've been in the in the battle, you might say, and you have seen some great success stories with DPC. Could you share just maybe a story of a patient who received something that changed their life, or a provider that came out of the traditional healthcare system to find a better way with DPC, and it changed their life? What is some inspiring, life changing story that you've witnessed for those that may be on the edge and considering joining this DPC movement? What's a real life testimonial that you would think worthy to share?
Hmm. I mean, there's lots, and I know, and I don't want to discredit that good things happen in standard old hospital ER rooms every week too, and every day as well, and people's lives are saved and impacted. But I think what really inspires me the most is the quality of life of the providers. Right? I think that's what's overlooked, is we're looking for a patient story. Those happen. Fee for service hospitals, it doesn't matter. People's lives get impacted in a positive way through sound medicine, and so awesome. But we have a provider, and she's incredible. And she came over and joined the team, and she worked with us for, gosh, probably 6 months. And then we asked her to come and speak at a dinner that we were hosting, as we were recruiting some new nurse practitioners and physician associates with us. And we asked her to stand up. We didn't prep her in any way. We just said, "Hey, just stand up, just share from the heart. You seem to enjoy this." And she's like, "No, I really do. It's been incredible." And she stands up and she begins to weep, right? And you look at this grown woman who has children and a family and a spouse, and she goes, "I can't believe that all of my career I did it that way." And we would go on family vacations, and I would bill and code and chart, in the hotel, bedroom, while my family was on the beach. And I'd tell them, "I'll catch you all at dinner." And I would spend the first 2 days of my vacation catching up, and the last 2 days of my 5-day vacation winding up. And so, and then every night I would come home, catch the window to put my kids to bed, and then jump back on and bill and code and chart. And then I'd wake up early and do it again. And now, when I moved over into direct primary care and working with Frontier, I don't do that at all. I'm able to go home and be with my family. When we go on vacation, I have time to be with them. And I am here to tell all of you that are interested in this, there is a much better way for you and your life and your family, and you can still make great money doing it. Like, this is the future of that. And then she started sharing about her patients, and it was like icing on the cake. But I think to change the quality of life in providers, like, that's the mission in a lot of ways, because healthy providers are going to produce healthy members, and that's going to help fix the healthcare issue. But if we're burning out of providers, like, how can they even tackle what's going on in the lives of the members they're serving?
Thanks, Joe, for sharing that story. I think that is a powerful message, especially for any providers considering getting into the DPC space. And so, Joe, I want to thank you for your time this evening. Do you have any parting words? You want to pitch any products? You selling anything?
No, I mean, um,
You want people to send their data so you can review it and see if you can save them money?
yeah, that's a bear. So, yeah, I mean, I think, my advice or my parting word would be go for it. I think, assemble a team, get out there, decide if you want to work with employers or not. You don't have to work with giant ones or, really big ones. We spent a lot of time working with small ones, and doing the 10-person group and the 20-person group and the 5-person group. And that was a really sweet season of life for us. Now it's, 5 and 7 and 10,000 at a time. And those are massive projects and it's very different. But, to each, whatever excites your vision for growing DPC in that movement. Go after it and look around the community. There's a lot of folks that want to help. I mean, there's great, vendors out there. There's great partners in this industry, whether it's, people like NextEra or the DPC Coalition or Health Rosetta or Free Market Medical Association or, people at Hint, whatever, Spruce, like, they're all looking in this way to educate, inform, so they can continue to stack providers in this movement that's going to change healthcare for so many. And so, yeah, join it, get involved, ask questions. You're not in it alone. Like, there's a lot of people that want to help out.
Thank you, Joe Wilson. To find Joe Wilson, you can follow him on LinkedIn. Also, you can find Joe at frontierdirectcare.com is their website. And Joe, fantastic job. Thank you so much. This is the Best DPC podcast. We want to thank you for your time. We hope you enjoyed the listen, and we'll see you again really soon. This is the pod. Bye-bye.
I think we need to do, we're trying to do, like, we have gotten a lot of feedback.
A revolution in care, where every heartbeat matters. Cutting through the noise with direct primary care that shatters the status quo and lights a fire in our souls.